everyone. Welcome back to Keeping Up with the Chaldeans. I'm Anthony Toma. This is my co-host here, Junior Binno, as always. We have Bianca Boji here today. She's going to give you a little background on what she's doing today, where she's at, and how you can benefit from her specialty, which is Invisalign. Hi.
Thanks for having me, guys.
Thanks for coming.
You on?
So yeah, I'm a general dentist. I specialize in doing Invisalign treatment, and I help a lot of patients with that treatment. I work at two offices, one in West Bloomfield called Hamoud Family Dental, and then one in Ypsilanti called Comprehensive Dentistry. And then I also help dentists with their treatment for their patients, basically how to give their patients better Invisalign treatment. And yeah, stuff
What
like
does that entail, giving their patients better Invisalign treatment? What is that?
So let me explain Invisalign first. A lot of people think that when you're getting Invisalign, it's just the product and you're good. It doesn't matter who does it. That as long as the dentist does Invisalign, you're going to get the same thing wherever you go. Mm-hmm. And it's not the case at all. Invisalign, there's a lot of behind-the-scenes planning that you have to do. Mm-hmm. You got to know how to move the teeth, a lot of behind-the-scenes planning. I've taken like a ton of courses and everything on it. And then you can, when you plan it properly, you can have a case for your patient that usually takes, can take around 8 months, maybe a year. But if you don't plan it properly, they can be in treatment for about 2.5 years and still not have good results.
Wow.
So we want to have good, efficient, predictable treatment for patients. And so that behind the scenes planning is where I will teach other dentists how to do that, or they'll hire me to do it for their patients.
So what does Invisalign do for those that don't even know what you're talking about?
It straightens your teeth. It's basically an alternative to straightening your teeth from braces. It's these clear aligners, and you wear them all the time while you're in treatment. You put new trays in every week, and they help you, they just help straighten your teeth.
Same effectiveness as having those wired braces in?
Yeah.
Time frame the same? Like, so for example...
Quicker.
It is really. So, like it was a pain in the ass. You had to go in, they have to tighten every month or do whatever.
Did you have braces?
Oh, girl. So, braces and teeth pulled and all that. And then
you had braces?
Yeah, and then I also had the retainer, which after prolongs the good effect of what the braces would do for you. It keeps it without shifting them back as easy. So I went there. But what we did compared to what she's talking about, oh my God, I used to have to, middle of school, you're in 5th, 6th grade, taking out your retainer, you were tightening things up to make it.
So you had an expander. So it's widening the arch. Yeah.
So we were doing stuff like that. So.
And if you ever lost it, you probably had to go dumpster diving to find it.
Either that, or you had to go back in to shove that nasty clay in your mouth and redo it all again. Yeah.
Oh boy.
So now what they do is they actually put the spacer inside, and then they push it apart. Now it's like almost tapped into your teeth now.
They cement them in. So you don't have to take it in and out.
Yeah.
A retainer?
Yeah.
Not a retainer. He's talking about expander.
Expander.
Okay.
Yep.
Gotcha.
So that's to give that. So once it's like they're prepping them for the braces or the Invisalign is what I've understood. Mm-hmm. So does it well, let me ask you something. Just so I was always confused growing up. Isn't there a difference that you have your orthodontist and you have your dentist?
Yeah.
They're two separate businesses, aren't they?
It is.
What is the difference?
So an orthodontist...
what exactly would you fall under?
So I'm a general dentist that specializes in Invisalign treatment.
Okay.
An orthodontist is someone who does everything with ortho, meaning expanders, braces.
Got you.
They also do Invisalign, the full 9 yards. If someone needs jaw surgery, they'll team up with the oral surgeon, and that way. I do just Invisalign. I don't do braces or anything else like that.
Okay, which is...
So there are some limitations. So if I see a child for an exam who would benefit from an expander or benefit from braces or something like that, then I'll send them to my orthodontist and have them, have them do their treatment.
Do you have a specific orthodontist that you work with?
I do.
Do you want to shout them out?
Yeah, he should be on the show, Brandon Shukri. I don't know if he ever has been.
Brandon Shukri?
Yeah, he's awesome.
Cool. Doesn't sound familiar.
So.
I mean, as being on the show, he has not been on the show, so.
He has. It's funny because he has two offices that are near both where I'm at.
Oh, really?
So one in Westfield, one in Dexter, I think. But he's great. I know him really well. I grew up with his wife, actually, named Bianca too. And I trust how he does his treatment. I know he does a good job. So it's nice. It's a whole team. You need to know everybody.
Wasn't Bianca, what's her name's brother? Oh God, we used to hang out with him. She just got married to him recently, isn't she, Bianca?
No, is it?
Oh, it is. Okay.
They've been married for.
Okay. But it's good to have that you have the two hand in hand together. People, I mean, I even have family members, they tend to lack on sometimes taking care of their teeth.
Yeah.
But they don't, sometimes they do that because they think the only importance is just chomping and chewing, swallowing, and that's it. There are so many factors, because I mean, things that I've gone through too, but like, holy cow, like the way it's just connected to your brain, your teeth, your nervous system, how bad and deadly things can be if you don't take care of them and stuff like that. So, I mean, it's good that, to have that conscious, because then, again, to come to you guys for stuff, because you're thinking, oh, it's just basic use.
A lot of people think it's just cosmetic.
That's what I'm saying.
They're like, or I'll talk to a patient about it, because there's so much more involved than just being cosmetic. And they're like, oh, I don't care, I'm not vain, I don't care about my crowded teeth. I'm like, it's not about you being vain or about cosmetic. Like your teeth will look great at the end, but that's not the goal. The goal is for everything to function properly. When your teeth aren't in the right position, it causes a lot of problems.
Sure.
So when you're talking about how it goes to your whole body and stuff like that. So when you have gum disease, for example, like a lot of tartar buildup, all that bacteria goes into your bloodstream, goes through your whole body. So that same bacteria goes everywhere through your heart and everything. And when your teeth are crowded, they're a lot harder to keep clean, and it contributes to having a lot more gum disease and stuff like that.
Yep, and that could lead to a lot of bad aftermath, with
Totally,
that.
yeah.
Pre the show, I mentioned to you, which is good because you're saying it, like, things change and shift. Like we're saying, Anthony, I did have braces when we were younger, but before we started, I was telling you, at this time when I'm biting, I'm having a shift in one tooth and it's clashing against another tooth now. So is that where you come into play?
Exactly.
Okay.
So teeth are always moving, and so you want them to just gently like slide against each other. You don't want them to bang against each other. And so when they're doing that, so what's happening when they're banging against each other is they're getting chipped on the edges, and then they're getting bone loss in that area, and it just staying in that bite long term, it's just not healthy for you, because eventually something is going to break or crack, and then we'll have to fix it. I look at a lot of my elderly patients who have had a ton of dental work, a lot of crowns, and like they're in their 70s and 80s and they're still needing more. They're still breaking their teeth. And I'm like, I wish I saw you 40 years ago and straightened your teeth, because you wouldn't have to deal with these problems. Yeah. Like, and this, like, no one wants to deal with that.
No, that's the thing. Do you suggest, I only had 2 of my wisdom teeth pulled, but I've heard like majority say leaning to it's better to take it because it doesn't affect your issues later in life with your shifts and stuff.
Yeah, it's case by case. So if you're wearing a retainer, so after you do braces or Invisalign, you should be wearing a retainer forever for the rest of your life, which I know is a big commitment, especially when you have braces as like a 13-year-old. And
you do what? Say that
just a retainer.
You should wear retainers forever after you straighten your teeth, whether with braces or Invisalign. To hold them in that position, you should be wearing a retainer always.
For what? Like
for the rest, to hold them.
It's
like for the rest of your life.
When
you sleep, yeah.
Oh, okay.
That was my biggest issue. Damn it, I'd find that thing next to my pillow every morning or on the floor or whatever.
So I would say probably like 70% of my Invisalign patients had braces when they were younger, and they lost their retainer when they went to college. Yeah, everybody. And then their teeth shifted, and then we straighten them again. But I give everybody 4 sets of retainers, and I'll give them more if they want, just so that you have something. If you lose it, you have a backup. Because teeth are always moving. So that's why you had braces when you were younger, but you're saying how your tooth shifted because you're not wearing a retainer. So wisdom teeth, if you're wearing a retainer, they're not going to push your teeth.
Which keeps it the same.
Exactly. So when you're talking about like putting pressure on your teeth and stuff like that, but like there's always a lot of different reasons too that wisdom teeth would need to come out.
Gotcha. You mentioned cosmetics or cosmetic. People think it's cosmetic. How does the insurance industry look at this? Is it covered by insurance?
Some insurances will cover it. They never cover the whole thing. They'll only cover portions of it. Basically, insurance tries to get out of paying whatever.
Of course, yeah. We all know that.
They're very frustrating to work with. I think anyone in the medical field is just...
Or any field that has to do with insurance.
Field that has to do with insurance.
So under what circumstances does insurance cover it?
Well, so every single time you're doing treatment, cosmetic is going to be a benefit. Your teeth will look great, but there's always the main goal is health. So the insurance company, if someone has ortho coverage, they'll cover it. So if you have coverage for braces, it'll cover for Invisalign as well. And
then so is there like I know they ask you if you smoke when you do life insurance. Is there a question or is there an exam before you add ortho?
No.
Usually X-rays, right? X-rays tell a tale for us, right?
So after you add ortho, how long?
Insurance, it depends on your policy. So like some of them, if you're a child on your parents' policy, they always put an age limit. So like they stop it at either 18 or at 26. It's rare that adults will have ortho coverage, but sometimes they do.
Okay.
It's rare. I mean, I have probably 150, 200 people in treatment right now. And of the adults, I would say maybe 15% had some ortho coverage.
Gotcha.
So I'm going to throw a little wild question here, but it leads to, I don't know if the stats are true, but maybe whatever. First off, when the hell made you think you want to stare at somebody's mouth for hours and smell something? Because for you to, I mean, what inspires you? Because the tales I've heard is, and I don't know true, but I've heard is there's a high ratio of, I don't know if it's suicide. Okay.
Yeah,
I'm okay
apparently.
to mention that. Okay, so there's a high rate of suicide for dentists, orthodontists, because they're staring at your face with stinky breath all the time. And the reason I'm just saying this because I want people to understand how crazy sometimes things can be. I had a root canal, and he did the filling, and he popped in the rods and stuff in there and told me I'll see you when the stuff gets in about 2 weeks.
Yeah.
Well, I lapsed over to a third week because I couldn't make it.
Yeah.
So here I am in the
Short
chair.
episodes,
Well, and this is how I found out. I'm sitting in the chair and laying down. He's working on it. When he got into it, I didn't pay attention that that's what it was. But holy cow, I'm like, man, his effing breath stinks. I'm thinking
You could smell his breath?
I'm thinking his breath. I'm thinking it's his breath.
Wasn't he wearing a mask?
He was. So at the end of the thing, he's talking to me. And he said, I had to clean it out. That's what took a little bit longer. He said, you had a little light infection that was there. And I said, Doc, was that the smell? He goes, yes, it was. I go, how the hell did you stomach it? I thought it was your breath the whole time.
Wow.
He goes, no, but that's the thing is just, we'll get you into it because you're going into ground zero right there. You know, you're dealing with.
Yeah. No, totally.
I have Chaldeans, no offense. I mean, we're in church and they're singing the song. And,
You smell
and
it.
you catch their breath from behind you.
From
Like,
a mile
whoa.
away. I'm like,
Yeah,
you have
like,
disease.
whoa.
You have got, oh yeah. Oh.
Yeah, it's there's
Especially
halitosis.
with
They say sometimes it's something with your digestive
It
system.
could be, or
It
your
could be
sinuses. If you have bad
too.
sinus
Yep.
problems
Yep.
too, like there's
Constant drainage.
Exactly.
Yeah.
There's just, stuff sitting.
But see
and
what
all
people
that
don't
leads to your
realize
breath.
that? That's what people don't realize, like stuff like that, how much it can affect and what it could do. That
Yeah.
infection could have led to my brain.
Totally.
And that's
Oh, yeah.
that's damaging, so.
What's
Oh,
what's the suicide talk? Well,
So there's
I
a
wasn't in
stat
on
that says
on that part of it.
that
So-
says dentists being a dentist, or there's the highest suicide rate in the dental
Profession
field,
as dentistry.
in the dental
Really?
profession.
Yeah, because they're looking
Not
at your
stock
mouth
market?
at all times. No, not the stocks.
I mean, I don't know if it's been tested. Apparently, one in every,
Do they include China where they jump off the?
That's one for Apple.
Nike or Apple?
That's at Fox, whatever core that they work at the iPhone company.
Yeah, I mean, that's a.
But I'm saying that's why I'm getting. To
I can
like,
think of a lot worse jobs.
What
Yeah.
gave you the inspiration to get into it and do it and get you to this point?
It was a very random route. It wasn't like since a kid I was like, oh, I want to be a dentist.
Right.
Like, not at all. So I have 5 brothers. Anthony knows them all, and one's an attorney, and 4 are doctors, and 4 of them are older than me. And so my older brothers, especially Mark, they were all saying like, oh, go to med school, be a doctor, just do what we do. It's amazing.
Yeah.
So I went to undergrad at Wayne State. I had a majored in biology in undergrad. And I knew I wanted to do something in the medical field. I didn't know what specifically. So then I'm like, all right, like they all did it. They all went to med school. I'm like, well, I'll try that. And so I took the MCAT. I applied to med school. I did all of that. And then I just kept thinking about it and like looking at residency and all the things that they went through. Because I mean, I had a direct view to all the things that they did. 3 of them are surgeons, and like that residency it's insane. For 5 years, you're 24/7. And I'm like, is this like really what I want to do like forever? And so Mark was talking to me, and he was like, well, why don't you look into dentistry? And I was like, ew, like no, I never even thought of that.
Yeah.
Like, that's weird. And he's like, well, just go shadow our dentist, our family dentist at the time, which now became me. But
That's it. How good is that?
and so I went, and I thought I actually really liked it. Dentistry is a great combination of, like, I love science and biology, but there's a huge artistic side to it. So
Yeah.
it's a perfect match. Like, I guess in the side that I do, there's a lot of sides of dentistry. You can do implants, you can do surgery, you can do all that. I love doing cosmetic dentistry, like veneers, and doing Invisalign. And so it was the perfect mix of that for me.
Veneer. What's veneer again exactly?
Veneers are basically how,
Replacement
if you want to
teeth.
change like the shape or the color or the size, if you want that like movie star Hollywood smile,
Okay.
that's where
So
veneers
if somebody's
are.
teeth are a little bit long, they can shave down, or is that where, or is that?
That, or you can add to the teeth. A lot of times people want
Got
like
you.
just bigger, whiter.
Yeah.
Yeah, so
Yeah.
it's porcelain. It's just a thin piece of porcelain. We designed it for your teeth, and yeah, looks
What's the
awesome.
recovery time from that?
It's quick. The whole thing takes just about a month. Like from when you
Start the process.
Yeah, for you start the process, you come in, we take photos, we take records, we see how we want to design your smile. And then I work with an awesome lab in Manhattan called, it's a Jason Kim lab. This lab has done Donald Trump's teeth, Giselle's teeth. They're incredible. So it's not just, so when you're choosing a cosmetic dentist, it's not just the dentist you choose. You want to make sure they use a lab who's making the porcelain really, really well. So you want to have a good team. And so I will design the smile with my patient and then send the design to my lab. And then we basically have our plan. And so the patient that first day, they'll get numb. We take impressions. They go home with temporary veneers on their teeth. They come back 3 weeks later, and we put the porcelain veneers on.
Gotcha.
So it's not a very long process at all.
What's the process like? So, for example, on the Invisalign, so like we just talked about, so if I want to come visit you, I'm calling your office, setting up an appointment, then where do we go from there? With or without insurance? Let's just talk the process as is,
So those impressions that make you want to like puke are completely gone.
Okay.
So we have digital scanners.
Okay.
So you would come in, we would do, we would take a digital scan of your teeth and some photos. That's all we need and an x-ray. That's all we need for our records.
Okay.
And then we have the scan in front of us on the screen, and we are looking at your teeth together and seeing how we need to fix your smile and how we want to, just so that it lasts long, it'll look great and all that. So we have our discussion of what we want to do, and then that's it. Then once we decide that we want to start, all the behind the scenes planning on my end comes in, where I design the entire plan, and then I order the trays and I'll have them back in about a month. So you would come in for that initial consultation, and then you come back a month later and get your trays, and then we start.
Okay. One question off, somebody who comes in does that. How many times do you hear, and what is your input on whitening teeth?
I mean, as long as you don't have cavities.
So like there isn't the enamel isn't gone. Like does it take enamel off when you whiten your teeth? Or?
If you do it properly, no.
Good.
Yeah.
That was my only scare was I get the stories of, oh my God, they're so sensitive after I did this.
They can get a little sensitive. It doesn't usually last forever.
That goes away.
Yeah, and there's a few different ways to do it. Usually, like, depending on the kind, sometimes the in-office whitening causes more sensitivity than if you were to do it at home. The nice thing with Invisalign is the retainers that I give you at the end double as bleach trays. So you can just whiten. With a lot of my patients just do that.
You recommend it?
Gel. Yeah.
Cool.
I personally like that because then you do it over like a week or two and you can see how white they're getting rather than in the office at 0 to 100. So you can't really, there's no in between.
Right.
And so when you do it at home, you can do what you want.
So you said that if someone had braces when they were younger, they should wear a retainer all their life. If somebody uses the Invisalign or gets the Invisalign, what's the upkeep after that?
Same thing.
Same thing.
Yeah.
Oh, so you do give retainers with the Invisalign?
Yeah. Oh, yeah.
That's why I wouldn't mind going to see her right now, because I was telling her with that right now, the more it kicks in, it's not that it's bad or something like going wrong in that sense, it's just shifting.
Yeah.
And if I would have done what she said and had the retainers, but she's right, man, we probably threw that shit away after high school.
It's hard to, I get it. It's hard to keep the same retainer forever. So you got to just upkeep going to your dentist, get new retainers.
What sort of technological advancements has there been since the olden day retainer to the new retainer? Is there
so much? Just that digital scan makes it a lot better.
Yeah.
It's way more accurate than the impressions that used to be taken. And we can order as many as we want, so you can always have backup. Especially like people who are moving out of town, I always give them extra. So, yeah. No, I mean they're just way more accurate, and so they hold your teeth a lot better.
Gotcha.
And how far advanced does somebody have to book with you? Are you pretty book solid, or is it weeks out, months out? Like, how's your time right now on schedules?
So I'm in Ypsilanti 3 days a week, and then I'm in the West Winfield office a few times a month.
Okay.
We can always get people in.
Good.
Yeah.
Where should the people that have taken advantage of your service of the Invisalign send the thank you cards?
Wherever. It doesn't matter.
Either okay.
It doesn't matter. No, it's always exciting when patients. What's really cool about Invisalign treatment is it's fun treatment. It's not someone who's coming in because like they have a swollen face and they have a giant toothache.
Right.
It's like, and I'm not giving you shots or anything. It's fun treatment that they want, that they're excited about. I love doing it. It's overall. So like when I had decided I wanted to go to dental school, I was like, okay, so I should probably, so I was still in the application process back at this time, and I was like, well, I should probably work in a dental office. I've never done anything in dentistry at that point. I should probably like learn something about it. So I applied to 20 dental offices near my house. I got a job at an ortho office. just happened to be that. And I fell in love with it. The guy,
Yeah.
he was an orthodontist. I was one of his assistants. I'm like, he gets to have fun all day and just talk to people and hang out and, you know, straighten their teeth at the same time. And so that's kind of where it came from.
Cool.
That's good. So, just a thought for like your what's your best marketing tools for that you guys use for the business itself and your attraction? Because you mentioned the age group, so people don't think it's just because I'm getting older I need to come see you. So, what's the age groups that you work with, and how do you market to those groups to know why it's important to keep your teeth, you know, in order?
Yeah, so I treat patients all the way from 15 years old to I have 75-year-olds in treatment.
I'm kidding.
So it just, you know, depends on your teeth. You come in, we take a look, and we see if you're a good candidate for it.
Yeah.
But then as far as marketing, I personally do a lot of social media marketing.
Good. And where can they find you on that? Where's your social media?
Bianca Boji D.D.S.
Okay.
So I always posting where I'm at. There's a lot of before and after pictures, like if you're curious, and I try to explain the process on there. Even for veneers, if you wanted to know more about that, I have pictures of that on there.
Sure.
So dentistry has changed a lot from what it used to be. It's a lot of fun. There's a lot.
Besides the drilling.
Oh yeah,
I'm saying besides
so
the
much.
that was the scariest sound. It haunted you forever.
Yeah. No, there's a lot of fun stuff with it, and I've gotten involved with a lot of organizations. I now teach for Invisalign and lecture to dentists just about how to do the treatment and how to do it well, and just to give your patient a good experience and good results that don't take 2.5 years.
Good.
That's great.
Question for just out of this. So, if somebody's got like an underbite, can Invisalign work with something like that, or if they've been told sometimes they have to break their jaw to reconstruct? Does that mean that bypasses you? There was no help from you. They would have to get to that point.
So if someone needs jaw surgery, so if they have that underbite, like that Leno jaw, no, I would send them to an oral surgeon and an orthodontist, and then they would, because once it comes to jaw surgery, that's where I'm like, nope, this isn't part of my specialty and what I know how to do, so I'll pass you to who I know does.
Does that person then possibly follow up with you after to say, I've reconstructed, I'm good now, keep my teeth intact and looking good for years to come?
Yeah, well, usually if they're doing that surgery, the oral surgeon's working with an orthodontist already. Okay. So then they're doing it from that point.
So if I came to you, I would start and say, here's what it is, and you're like, listen, bud, your shit's out of whack. We're going to have to work with this orthodontist here, and we're going to work together and pair you up and get you looking on point so you're not looking like Leno. Right?
Exactly. Well, that's what we do during the consultation. Is like we look at that and I'm like, okay, is this something that we can do here, or is this something that I'm going to send you for?
Gotcha.
And so majority of the cases I can do, but then of course if I think you'll be better served by an orthodontist, that's when I send you out.
Gotcha. Yeah. So now that you've arrived, you're a dentist, you found a specialty. What was the road like, and how, would you encourage others to kind of take the same path that you took, or do you think it was a struggle?
No, I mean I love what I do. I have a lot of fun with it. So another path would be is you can become an orthodontist. Mm-hmm. The one negative side of that was a negative in my opinion, is I still love doing general dentistry. I love doing cosmetic dentistry, like the side of like veneers and stuff like that. And when you're an orthodontist, you don't do all that. Right. You have to stick to your specialty. So you're just doing braces and Invisalign and all that. Mm. And so the amazing thing about general dentistry is there's so many parts to it, from implants to root canals to what I do. And so I looked at it as when I graduated, I'm like, well, I can't be good at all of these things. There's like 20 different fields. And so I'm like, let me find what I really like and get as good as that as I possibly can. Mm-hmm. And so that's where I picked Invisalign and cosmetics.
Gotcha.
So I mean, so if anyone was interested, I'm happy to help. I have a lot of people who come and chat with me a lot. Like dental students will message me on Instagram. So I mean, if anyone has questions, feel free to reach out. So like, if somebody's breath is stinking really bad, often I can say, hey, I got somebody. You may be able to go see who can help you. Happy to. No, happy to, because, I smell it too. Yeah, I'm telling you, it happens. Mm-hmm. It happens. I mean, it doesn't matter if you smoke cigarettes or anything else, or if it's just day to day, you just, ugh. But flossing is a big part of it. That's what a lot of people tend to forget, to floss. Oh, and when people don't and they're complaining about their breath, I'm like, well, are you flossing? And they're like, no. I'm like, well, floss and then smell your floss. Yep. And you'll see. And it's so gross. But like that, you'll see how bad it is. Good. Well, I got to come see you for sure. That's definite. Because like I said, the shift is already there. I kept my 2 wisdom up top. I don't know why he did those. He took the bottom 2 out, but
I have all 4 of mine.
Do you really?
That's why I'm so smart.
You're the most wise person here.
Yeah.
I don't have any of mine.
Yeah. No, I think what he said there was enough room back there for them to grow in.
I have all mine. Wisdom.
Yeah.
You still have them in place?
It's rare that
we got
people
two
have
smart
room,
people.
but that's cool. That's cool. You know what's funny? I think a lot of my brothers have too. I feel like Thomas have big jaws.
I actually have room for 2 more. Top
Oh,
and
yeah?
bottom.
Does it
yeah.
ever bother you though? Do you ever get like a headache or anything like that?
No, only when I'm here.
Yeah. I feel you.
So your tips for bad breath are flossing.
Flossing,
Yeah.
brushing. I always start with the basics. Like, are you brushing twice a day? Are you
Yeah.
flossing? Are you using mouthwash?
Mouthwash.
Those are, most important things. And then from there, okay, then we can go and see. Like, some people have gum disease, and then it could be other problems. But get the basics down.
Is there always a fix for bad breath?
If you know the cause, yeah. Because some people, it could be coming from, like, gut issues. It could be coming from their sinuses. So once you figure out what's causing it, yeah.
You know that can tell a tale if you have an actual something worse off going on in your body.
For sure.
Right.
Yeah, it's like letting
Oh, yeah.
off that stench.
I think a lot of people don't realize it's coming from your sinuses. If you have bad allergies, bad sinuses, and you're not, cleaning it out.
Tonsils play a
comes right
big
to your
part
mouth.
too.
Yeah. Oh yeah,
God.
because stuff can get stuck back there.
Yeah. That's
where my
definitely-
brothers come in handy.
Yeah, no, I didn't take mine out. They just say it captures more, but I get a lot of drainage too, and that's what I'm saying. Like I know what you're saying. If you don't drink enough water and that drainage keeps building back there,
Yeah,
ugh, it's dry stank breath.
Basically.
Sorry,
Totally.
gotta
Yeah.
go.
Yeah, but no, dentistry it's a great field. I feel like especially for a woman too, because you can make your schedule what you want. I mean, I have 2 young children, 1 on the way, and
Good.
I work 3 days a week, and it's great. I mean, it's a good schedule. You can definitely make what you want out of it.
Do you need any help right now to hire? Maybe possibly like in our community we can find maybe assistants or stuff that you can
Always,
use.
I feel like every field. Could
Where would they submit?
Message me on
or-
Instagram.
Okay, cool.
Yeah, Bianca Boji D.D.S. And
Good.
you can come to West Bloomfield or Ypsi.
And we'll include all that, so it'll be at the bottom of your video, so people know to be able to look for you. And that's a big thing right now. A lot of things have changed in our industry, to say, in our community. So everyone's shifting back to looking for true jobs and looking for real
I'm
careers
hoping.
again. So
Yeah.
good.
Yeah,
So
no,
hopefully
it's
they'll
a
find
fun career. I mean, we have fun all day at work with our assistants.
you. Good.
So
Good.
yeah.
Was there anything we may have left out, or that you want to bring a point to, or let the audience know maybe a tip or two that they should always do? And glad to see you.
I mean, keep brushing and flossing. If you ever were curious about straightening your teeth or you wanted to know what they would look like, you can come in. We can show you a simulation of what your mouth will look like at the end of treatment, which is
Cool.
cool with that scanner.
Yeah.
So
If they only knew, just so the viewers, if because of the age we're at, but that stuff they used to put in our mouth, that was
Horrible.
as he's doing that.
I remember when we had to
too.
practice in dental
It
school with
was-
each other, and I'm like, okay,
God.
I'm not doing this. I'm
Right.
opting out of this.
I'm so glad they advanced. Thank
Oh,
God.
it's horrible.
Yeah.
What's the appointment lead time? Like how quick would somebody be able to get an appointment with you? Are you backlogged? Does it take time? Or?
Usually within the next couple weeks, you can get an appointment.
Oh wow, that's
yeah,
great.
Yeah, usually
For
because
especially these days.
usually within the next couple of weeks. Consultation appointments, what's nice is they don't take too long. Usually about a half hour. I
Yeah.
know my patients are busy. I have people who what's cool about Invisalign too is like it doesn't matter where you live. I have patients in Arizona, Texas, Chicago, that drive a couple hours, and a lot of the treatment, I can give you your trays and then I have ways to monitor you virtually. So you also don't have to be right next to one of these offices. You do have to come in a couple times. It's not that the entire thing is virtual, but we can do the treatment from anywhere. And
That's
the appointments
cool.
don't take too long at all.
Cool.
Modern technology, baby.
Oh yeah, it's
Yeah.
awesome. I can basically be constantly seeing what their teeth are looking like, and we have ways that they are sending me pictures and systems and.
That's what I'm
So
saying.
I'll be
place.
seeing you in Miami more often then, is what
That's
you're
the
saying.
plan. Yeah, I can do all the behind the scenes planning for the
Excellent.
beach.
Pull up at one of the cabanas and she's working on somebody's teeth real quick. Be like, I'll be right with you.
It's funny, we were there a couple of weeks ago, and I was just, had my computer.
Yeah.
I was designing some cases in the background. You can do it from anywhere, especially
Yeah.
this part where I help other dentists do it. I love it. I can do it from wherever.
That's
Good for
cool.
you. Good for leading.
Yeah, it's
women
fun.
there.
It's a lot of fun.
You lead we're in our community to the next phase in life. You know what I'm saying? So
For sure. So we end every show with pretty much the same question. It's what does it mean to you to be Chaldean?
It's a good question. I'm very proud and very honored to be Caldean, but I was thinking about it because I had a feeling this question was coming.
All right.
And what I love about being Chaldean is I feel like our culture and our community is like all encompassing. Like there's someone who does everything, and it's amazing. I feel like it wasn't like this before, and we have so many specialists and so many people who are good at so many different things that it's incredible, and you can do so much just within our community.
Yeah, that's cool.
Yeah,
Beautiful.
it's an
Good
awesome
answer.
field.
Good.
It's the first time we got that answer. Very nice.
Oh.
Yeah.
Cool.
All right, well, thanks everyone for joining us. Junior's going to close us out. He's going to remind you to like, subscribe, and
Yeah.
all
Thanks
this
for
other
having
stuff
me.
that he has.
Yeah,
Thank you.
great to have you on. It was awesome having Bianca on.
Brush your teeth.
Yeah, I was gonna say, make sure you guys don't walk around with stank breath. We don't want that. So you've got to visit her. At the end of the day, she can help you out, make your smile look that much beautiful, and that's usually first impressions, folks. So when you check her out on YouTube, make sure if you don't do that, you listen to her on Spotify, iTunes. Any of the platforms are out there, you'll have us on there. We'll have all her information at the bottom. Make sure you hit like and subscribe on us. From Anthony, Bianca, myself, and the camera team, we are signing off with Keeping Up with Chaldeans. Till next episode.